No, we had to start it on Facebook, I believe. Nope. Yep, we are live. Okay. So you got Pete Miele and Dr. Daryl Black here.
There we go.
One of our first times doing this, but we hope to do a lot more of these as the time goes on. So we're just sort of working out the kinks here. But yeah, we're going to be talking about social distancing in the Civil War. We're practicing good social distancing here by being in our own homes.
That's right. Pete's on the other side of the ridge.
Little more than 6 feet away from each other, but staying apart all the same. And we want you to put in your questions. I'm going to try to be monitoring the questions as we go through the event here. And if you have any questions, comments, anything like that, please put them in. So I wanted to start by thinking a little bit about, how did people view the world in the 19th century, and how does that lead to thinking about why social distancing was a thing. And of course, they didn't use the phrase social distancing, but if you start to look back and look at what they're doing and what they're hoping to achieve, it really sort of is similar to what we're doing today in terms of staying farther away from each other, making sure that there's lots of fresh air. But the prevailing medical theory during the 19th century was this theory of miasma, and that bad smells and bad air were the cause of disease. And this has been around since, the Middle Ages. That was what was causing disease. This is before germ theory. It's sort of right on the cusp of germ theory, but we're thinking 20 or 30 years before the idea of germ theory is really accepted. So this is something that physicians, the public, a lot of people are subscribing to, and it is something that is coming about in cities, in these large urban areas, New York City, Philadelphia, even over in Europe, that the bad smells of rotting, decaying matter, all of those slaughterhouses, animals, rotting vegetables, are what's causing disease. You something to?
No. I think there are a couple of really interesting points here. The first one is this whole notion of accepting germ theory. Germ theory didn't just suddenly come along and people go, oh wow, that's exactly what's causing this. And there's some really interesting, and we'll talk about this in a few minutes, but some really interesting conversations going on amongst the surgeons and hospital stewards of the Stonewall Brigade about theories of how smallpox is transmitted or was transmitted. It was a serious problem in the Confederate Army in 1862 and 1863, big outbreaks. And so this whole notion of people thinking through and making arguments in favor of ways and methods of transmission, because if you think about it, they're kind of they're more than halfway there.
They're getting there.
I mean, there's something in the air that's making people sick. They haven't put their finger on it, but there is a correlation, and they're beginning to understand that. So,
yeah, and I think
it gets to this whole notion of scientific knowledge and how scientific knowledge is developed. We're watching this right now.
Right.
We're seeing doctors have different theories about how COVID-19 is transmitted, the virility of it. I mean, it's really interesting stuff to look at in terms of virology.
And that's something I think a lot of the programs that we do at Seminary Ridge Museum, we talk about what did they know at the time and how did they view the world. And I think that one of the things that's come out of people living through this COVID-19 crisis is thinking about how we're experiencing history and what do we know and how has that changed over the last two months. Right, exactly.
Yeah. It's remarkable. This is, you can go back and look at some press, especially National Public Radio's coverage of the emerging disease in Wuhan, and people are kind of there's lots of head scratching going on, and trying to really figure out what's going on. So it's something that was happening in the 19th century. It's something that's happening today. Is that there are people thinking through these problems and using their interpretive toolboxes, their scientific toolboxes to make sense out of the world.
Yeah.
And then make decisions. That's,
right.
there's two parts to this. It's a decision making process that's embedded in it that's most critical because lives are at stake. Period.
Yeah. So you brought up an interesting point that it's sort of they're getting there, and I think one of the books that I was just reading as we were prepping for this was talking about germ theory, not as a watershed moment, but more of a turning of the tide, and that's kind of getting started even as the Civil War is breaking out. There's this great new book that I'll reference throughout. It's called Smell Detectives, and it's I think it's a couple of years old, but they talk about how even at the onset of the Civil War, as they're starting to clean up London, and these people are tasked with cleaning up all of the grime and filth and noxious effluvia of London, they're not getting sick.
Yeah.
And they're starting to wonder now, wait a minute, is this miasmatic theory really a thing, or is it are we barking up the wrong tree? So I think that's 1860 or so. But getting back towards the Civil War, and thinking about these camps becoming basically the equivalent of large urban environments. And actually William Hammond, who's the Surgeon General, becomes the Surgeon General in 1862, and is very forward thinking in his approach to thinking about medicine and disease during the Civil War. He writes this book on camp hygiene in 1863, and he talks about how the regulation camp of the Union Army would be equivalent to about 86,000 people per square mile, whereas London, which I'm pretty sure at the time is the largest city in the country, in the world, has only 50,000 people per square mile. So they're looking at it and comparing it to what they already know, and seeing that what's affecting these large urban environments in terms of disease and sickness are the same thing that are now affecting these camps.
And it's important to think about a couple of things in relation to these rapidly emerging urban places. First off, most Americans lived in rural places.
Correct. Yeah.
Black and white lived in rural places in the 19th century. So, one of the more interesting observations that Joe Gladhar made a few years ago in the Fortenbaugh lecture on his study of the Army of the Potomac is that the guys who were from the cities did better initially in the camps than these guys from out in the country. You think of these hardy country boys from the woods of Pennsylvania or the mountaineers in Tennessee or wherever. You think of those guys being the archetypes of the successful soldier, but at least in the first phases, the guys who had been immersed in these germ pools did much better. And there's something else that this interesting too, because not all the guys that are coming from the cities are having good luck either, because in the 1840s, and we talk about this a lot when we do medical programs in the museum, and we think about the ways that medicine was understood, the political and cultural practices and how they influenced the professionalization or the lack of professionalization in medicine in the mid 19th century. And something that I read yesterday that kind of turned my brain upside down a little bit is that in the 1840s, there was a back off, that people were backing away from smallpox vaccinations. People had been inoculated since the mid 17th or mid 18th century, about 1742 or so. And then at the end of the 18th century, a less dangerous form of protection, the vaccines, rather than they're using cowpox rather than live scabs here, and so they're vaccinating Americans and Europeans as well in the 1810s, 20s, and 30s. But in the 40s, there's a real drop in the number of vaccinations. So if you think about it, the average age for a Civil War soldier is 21, 22 years old. They had not been vaccinated. They were born at a period where vaccinations were out of favor, and it resulted in a lot of sicknesses in the camps. The numbers are staggering when you look at just smallpox alone. We all know that the disease killed more people than bullets and artillery shells. But when you start thinking about, okay, the number, and this is a reliable number, 5,500 per 1,000 cases of smallpox in the United States Army. So if you run that out to, it's 5.5 per 1,000, which runs out to 5,500 per million. So you can go online and look at what the instances of COVID are, and you can see what a drastic experience this was for these guys who were coming into these big camps.
And I found the same number from typhoid. Is like jumps from 0.5% to 8%. Between the outbreak of the war in 1862, so there's these major jumps. I want to just jump back for just a moment to talking about what you were talking about with many of these guys coming from rural communities rather than urban. And in the 19th century, I mean, there were a lot of factors that contributed to people moving out west, but there was this pull towards the fresh air, the mountain air, in some cases getting out of these urban cities, again leading towards some distancing there. But you read in the book that I just referenced, Smell Detectives, talking about how upper class people could afford to get out of the city for a couple of days. I mean, even Lincoln is doing it
he goes to the cottage.
Goes to the cottage to get out of those bad smells and the swampy miasma of downtown DC in the 1860s. So there are a lot of things at play, but to get back to the smallpox and the disease factor, there's starting to be this discussion between contagionists and anti-contagionists over how is disease actually being spread, and we've talked about bad smells, but one of the ways to counteract that and what you're seeing during the war is the increase in ventilation. And again and again and again, and I know we both have sources to talk about about the need for ventilation, the need for not overcrowding. There's a great manual that's published in 1862 on the conditions of camp diseases, and chapter 3 is called flat out crowd poisoning. So that's kind of what they understand. And when I look over here, I'm watching my iPad to make sure that we're still going live over here. And so when you see me messing around over here, that's me on the other screen. And I saw we froze for a sec. But anyway, talking about making sure that tents are well ventilated, hospitals are well ventilated, and this is something that starts pretty early on, and even you go back to Jonathan Letterman, who becomes the medical director of the Army of the Potomac in the summer of 1862, and sort of revamps the medical system of the Army of the Potomac right from the beginning. One of the things that he stresses is ventilation and not cramming these guys into tents and into camps and everything. And one of the things that we tend to focus on within Civil War medicine is thinking about those heroic actions that are happening after battles, the heroic actions of field hospitals and that sort of thing. But a surgeon was so much more than that, and there was so much in terms of caring for the patient, caring for the needs of the soldiers in all aspects of wartime service.
Well, they're monitoring nutrition, they're monitoring illnesses in camps, they're looking for evidences of diseases like smallpox. They're discussing, in the case of the 4th Virginia, they're the hospital steward, who's really kind of the manager of each regiment. this medical care and issuing out the medicines and taking sort of the daily care of the regiment. They're the doctors and the surgeons and the hospital stewards are gathering together. They're looking at these cases and they're making group diagnoses. There's an instance there are two really big smallpox outbreaks in Lee's army. One in right after the Sharpsburg campaign, and then one during the winter of 1863-64. So they're in these static camps. They're in these places for a long time. They're crammed together. They're in these small huts. It's ripe for
disease.
And they're very, very concerned about the towns that are around. It's not just the civilian or the soldiers who are experiencing these smallpox outbreaks. And they're hearing that in 1862 there's a when the 4th Virginia is organized, there's they're camped near Winchester, and they hear that there's a smallpox outbreak in Winchester, and they immediately start vaccinating all of these soldiers. This is in the spring of '62. So the guys who had already been had been vaccinated or had developed an immunity, but through getting sick and then surviving. But they went into an immediate vaccination program to make sure that all of those soldiers were taken care of. Getting back to the specific case of social distancing, and there's a great passage, and there's a wonderful diary called "Repairing the March." Let's see if we can do this. Repairing the March.
There it is. Yeah.
Yeah, there it is. It's the diary of John Apperson, who was a hospital steward in the Stonewall Brigade. And he writes pretty extensively about variola and smallpox, variola being the first physical expression of the disease. And they're constantly watching out for this. They're constantly creating separate hospitals for smallpox patients. But he writes about going to, at one point during the war, he was a steward in the 2nd Corps hospital, and he went to visit some folks and have dinner at a fairly wealthy planter's house, and they didn't want him to come in the house because he had been working with the smallpox patients, and they were afraid that he was going to communicate that disease to them. So there's this back and forth between the army and the towns and the civilians that are around them, and they're all very. It was a little bit surprising to me. I knew that this was a problem, and I knew that there had been outbreaks, but I didn't quite know the vigilance is the wrong word, because it was a little bit more nerve-wracking than being vigilant. They were very, 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 soldiers and civilians alike, very concerned with the communication of smallpox.
One of the questions that's come up on Facebook here is asking, why were they not getting vaccinations in the 1840s?
It's a cultural thing. There's a in the 1830s and the 1840s there, and Pete, you might be able to speak to this a little bit better than I, but there is, we've all heard of Jacksonian democracy,
sure,
and the rise of the common man, and there is during that period a pullback from scientific knowledge as being an arbiter of truth, and anybody could be a doctor.
Yeah.
You've got professional doctors who have been trained in European schools and in Philadelphia, trying to push back against this, but the dominant mode tended to be very democratic, very non-professional medical care. And
that's my understanding is this idea that there were these kind of pay to play schools. That's not the right word, but schools where you could just pay money, and were sort of diploma factories. That's what I'm looking for. In the early part of the 19th century, and this move away from scientific medicine towards a more, hey, anybody can do this, and that sort of has an impact on the idea of miasmatic theory, that everybody has a nose, everybody can. There's this sort of common sense. Hey, if it smells bad, it's bad for you, and and people are going around, and that's how they're making sense of the world and staying away from bad smelling areas and houses and things like that. But yeah, we as we were getting ready for this, we were talking about quarantine a lot too,
Yeah.
as you and I were thinking about the idea of quarantine, and thinking about Jacksonian democracy kind of rolls into a debate and a discussion about quarantine,
Yeah.
and this aversion to it in the 19th century, because being suspect of authorities and being suspect of people telling you what to do. But as the Civil War really changes the way that the relationship that people have with the government and the way that government medical authorities are seen. We can see this in the birth of the Army Medical Museum and the publication of the medical and surgical history. But Shauna Devine, in Learning from the Wounded, writes about how quarantines were put into place in Civil War hospitals, and when it was seen how they could be effective, that sort of made the general public think about it differently, and think about the fact that if you quarantine a specific group of ill patients, that it's going to be good in the end.
Yeah, November of 1862, as the first big smallpox epidemic breaks out in Lee's army, they're very quick. They are very quick, and at least in the Stonewall Brigade, very quick to put regiments, companies, and individuals into quarantine. There was a case a single case of smallpox in one of the companies of the 4th Virginia, and they immediately separated the regiment from the brigade, and then the company in which the smallpox had shown up from the regiment, and then took a couple of individuals and separated them out at an even greater distance for a couple of 3 weeks. And Apperson writes about, and he said it's kind of pathetic that this guy's over here by himself, and he says they'll walk up, the cooks will walk up and they'll put the food down about 50 yards from this guy. And then they'll go back and he can come and get his food.
Yeah.
He said the worst thing about watching this is that this guy was incredibly bored because he was illiterate. He couldn't read. So even in his isolation, he couldn't read any literature at all. So he couldn't write letters to his family. There was certainly a sympathetic view to what was going on with the individual in isolation, but they were very, very quick. It didn't take much. It was, they went from seeing the first case, in this instance, the very first case, I want to say November 17th or 18th, 1862. The next day, when they confirmed the case, they separated the 4th Virginia out.
Wow.
As the regiment by company and then by the individuals. And they stayed that way. And quarantines like that happened throughout the Army. I remember years and years and years ago, went with a friend of mine, Bob Parker, to see the quarantine camp, the site of the quarantine camp for Cheatham's division during the winter of 1863, when they're camped around Tullahoma and Shelbyville. It's a beautiful place. It's up on the top of a little ridge, nice and airy.
Probably nice access to fresh air.
Absolutely. It's the top of a ridge.
Yeah.
A really pretty spot, but it was a long way from where they put that camp and where the rest of Cheatham's division was. They wanted those guys out of the way. So this is a practice that's not only going on in the Army of Northern Virginia and the Army of the Potomac, it's going on in all of the armies on both sides.
We had another question come in a little bit earlier. To what extent did perceptions of race fuel people's theories on the spread of illness and disease in the Civil War?
Well, yeah, that's a great question. We certainly know that racial ideology had a lot to do with the way that people looked at certain environments. In urban spaces, particularly, you see African-American districts seen as dirtier and they're smellier by the observations of whites, and so with the noxious effluvia theory, certainly those African-American communities within cities in the South were seen as seen as dangerous places.
And
we
smell
know,
detectives talks about that,
yeah,
about people were very wary of the smells emanating off off African Americans,
yep,
and
yep.
thinking that was a harbinger of disease.
Yeah, it's something we do know a good bit about what happens to African American men and women who
Hmm.
come to the Union armies during the
Yeah,
Civil War.
yeah. Jim Downs' work.
Jim Downs wrote some great work, did some great work on teasing that out, and the death rates were phenomenally high amongst the African American men and women who came to the army, especially those who joined the USCT. The cases of, so we had 5.5 per
Hmm.
thousand of smallpox for whites, 36 per thousand for
Hmm.
African American soldiers at the same period in 1864. There's a remarkable difference. There's a remarkable difference in the ways that those black soldiers were treated medically. There was a fair amount of neglect that came along with that experience. And something that Downs really writes about very convincingly is this notion that all of the structures that had surrounded the medical care of African Americans had centered on the plantation
Hmm.
largely, and that with that gone, in that system of treatment, even both professional and folk remedies,
Hmm.
really impacted the health of these self-emancipating slaves who end up in the Union Army. So they're out of
Hmm.
their network. They don't even have access to the plants that they used
Right.
as medicines, and very successful in many cases, according to Downs. And we know the southern fields and
To
forests
forest, exactly.
is very, the what we call folk remedies
Hmm.
are very effective. But
Successful.
yeah,
Yeah.
yeah,
Yeah.
the whole experience of African Americans in during during the wartime period was an extraordinary. It was an extraordinarily tragic
Hmm.
in the ways that these people who are fleeing bondage and seeking freedom end up suffering severely as a
Yeah.
result of that decision.
Yeah, and his work has been really great in sort
Yeah,
of in telling that story, telling
yeah,
an unknown or understudied story up to this point.
yeah.
But I want to sort of not shift gears, but think about what's going on today, and how can we take this information. We had somebody comment thinking about his history teaching us, history informing us, and I think that's one of the things we're
Yeah.
trying to really, well, we do with everything, but thinking about today, the current time, and what we can learn from today. And I think one of the things is sort of this evolving nature of disease, and
Yeah.
the idea that we try to look for these answers. We try to look for the yes or no answer. This is good, this is bad. And as we've really seen over the last 2 weeks, and then even going back further, 2 months, 4 months, it's just our understanding of how COVID-19 spreads and has just changed many times. I mean, when we first started talking about this, gosh, 2 weeks ago, 3 weeks ago
3 weeks
today,
ago. Yeah.
we were saying, oh, it's spread by surface, not through air, and now it's no, it's
Yeah,
in the
AAM put
air.
out
It shades differently.
yeah,
So it's just we have to keep thinking that there's always more work to do, and
yeah,
there's more to learn about how diseases operate and how they spread, and all of that. I mean, miasmatic theory was the way to think about it, and 20 years later, no, it's not.
no, it's not, absolutely.
Hmm.
And thinking these things through is important. And we can back up to the historical side of things for just a second and think about, we talk a lot about at the museum. We talk a lot about the ways that scientific knowledge emerges out of the experience of the Civil
Hmm.
War, and that there's more medical knowledge after the war than before the war,
Hmm.
and that they're experimenting and they're recording and they're having meetings and all of this. And they're putting these theories into practice. And certainly in the case of Apperson in the 4th Virginia, they are enforcing these quarantines. They're very quick to quarantine and separate. They understand that it's a communicable disease.
Yep.
They don't know that it's a sneeze yet.
It's droplets and respiratory.
If you're, if you're close to this guy, you're going to get sick. There's a good chance that you're going to get sick. And let's remember that we have these during the Civil War, you had these not only large military camps, but large hospital facilities. And to me, one of the most fascinating books that I've ever read that deals with any aspect of the experience of the Civil War is the 1863 Hospital Steward's Manual. And I think it's important to remember that, Pete's referencing this book published in 1862, probably late 1862. And then the text that I'm referencing is 1863. They're learning lessons. Yeah. And they're publishing those lessons, and they are sharing those lessons, and they're sharing this knowledge. And so they're following scientific method. They're observing a problem. They're theorizing, hypothesizing, and they're drawing conclusions about what to do. And some of it's transmission theory. That Apperson has a long conversation with Dr. Black, the surgeon, one of the surgeons in the Stonewall Brigade, about his theory about how smallpox is communicated. It was interesting. I didn't quite follow it. It was kind of convoluted, but it was very interesting. They're having this conversation in camp. They're thinking about these theories. The Hospital Steward's Manual is a practical book. It's an instruction book about how to set up a hospital and how to organize the people in the hospitals. And one of the most important things that is in this manual is the very specific instructions about how to separate people and how much space and how much air circulation has to be made available for every single soldier. They don't know that there are invisible germs in the air that are making people sick, but they know that there's something about that close proximity that makes people sick. Let's see, it's on page 103. It says each patient in a hospital should be allotted to him from 1,000 to 1,500 cubic feet of space. And so they're thinking about the proximity of the cots, and they're also thinking about the boxes of air that are around these people and how much air can then be circulated through a hospital facility. And it's just fascinating to think about. And they're also thinking about cleaning.
And that's something that's coming into play. I think there's Walt Whitman walks into a hospital when he starts to go and look for his brother in 1862, and he walks into this hospital. And he's met with this horrible stench, and he's initially like nauseated, and he realizes that it's not a dead body, it's carbonic acid, but it was something that was so offensive to his olfactory sense that but it gets at this idea that they are using these disinfectants and deodorizers again to cover the smell, and they're not using it on tools. I mean, they could very easily have used carbonic acid on tools. It would have sterilized the tool, but that was not the mode of transmission in their minds. We need to, so Civil War hospitals probably to us would have smelled very clean in terms of a chemical smell that we associate with cleanliness today.
And that's on page 102. Of the cleanliness and ventilation of the ward should be that a person entering from the open air not receive the slightest odor or slightest close or unpleasant odor. And you can look at the photographs. There's a great series of photographs of I think it's the Chase Hospital in Washington.
I think so.
That shows the wards. They're big, and you can see the practical implementation of this distancing. The cots are very far apart. The ceilings of the hospital are very high. And there's plenty of light. There's plenty of open spaces to get that air.
And that's even in the field hospitals. They're thinking about that, putting field hospitals in barns where there's open ventilation. You look at the photographs from Camp Letterman out in Gettysburg. The tents are set far apart. They're well ventilated. They have wreaths and pine on them to cut down on the bad smell. covering the smell. It's not of course dissipating it exactly. But I think, you know, we're at, gosh, much longer than we just started talking, as we usually do. We get to talk. But I share the books that we're reading, because I know everybody is cooped up inside in their own quarantine. So if you're looking for something to read to get some more information, this book, Smell Detectives, by Melanie Ketchley. I think it was published in 2018, 2017. It's a great book on olfactory history of 19th century urban America. And then, of course, my well-worn copy of Shauna Devine's Learning from the Wounded, which is 2014, but a fantastic, just game changer in the way to think about Civil War medicine and health and knowledge creation. So if you haven't read this, I very, very highly recommend it. And what are you reading, Daryl?
What am I reading? Well, I'm reading Repairing the March of Mars. It's the Apperson's diary is fascinating. He's a really articulate guy, really sharp fella, and I've been looking for a reason to read it. Pete does medicine and I do religion, so it's been a little bit out of my field of vision, but it's a great read. Really interesting insight into the medical operations of Lee's army. One of the best, most detailed pieces on that I've ever come across. You can also read. You can get the hospital manual online at the Internet Archives. Is the conditions of the camp disease book.
Conditions of camp disease is on the National Institute of Health website, in fact, and that's a good one. Jonathan Letterman's memoirs, Medical Recollections of the Civil War, is really great into his view on what he does in 1862 to try to.
Is medical and surgical history online?
Yes, it is. The Medical and Surgical History of the War of the Rebellion. It's a 6-volume set that brings together all of this data, aggregate data on medicine during the Civil War. Doctors were instructed to write up cases and send them to Washington, D.C. And in the years after they published these case reports and then interpretations into this 6-volume set. So that's the primary source basis to start if you want to study Civil War medicine.
Yeah, and the Confederates had a similar operation. It wasn't nearly as well organized and published. And I'm suddenly forgetting the title of the book or of the magazine. It was a magazine that was put out, circulated in the Army, and it does the same kind of thing with casework. Some really innovative surgeries that are going on. One of the things that we've learned recently about Confederate surgeons is that they are by and large a more elite backgrounds and had attended elite medical universities in Europe and in the North. So it's something, I guess, for most people, something of a surprise, but if you look at the higher levels of Southern society in the years before the war, there's a tremendous amount of learning, tremendous amount of training in Europe and in the best places in the North. So,
all right. Well, this is hopefully just the first of many of these Facebook live discussions to bring the museum out beyond the 4 walls and the borders of Gettysburg in this time of quarantine, but even beyond it, we can do more of this. So thanks for tuning in, and if you have any other questions, feel free to post them on our Facebook page. We'll get to them, and we hope to see you all at the museum hopefully soon. So
all right, y'all take care and be safe.
Thank you.